never be defeated. The workers united will never be defeated. The workers united will never be defeated. Workers united will never be defeated. The workers united will never be defeated.
This is about safety for the patient and the worker.
It's hard on a person's back.
We're so short-staffed.
And there's no proper equipment.
These issues, they're life and death.
We are CWA! CWA!
These Western New York CWA healthcare workers are heading to Albany. They're looking for a rapid response to their concerns that they and their patients are at serious risk. What's at the heart of this matter is an effort resuscitating a bill ensuring safe patient handling.
The people are coming in on an average greater than 200 pounds, 250 obesity.
Last year, I really got hurt lifting a patient that was over 500 pounds.
And I had a severe back injury that left my right leg not moving for almost 3 months.
The thing that we could do at Catholic Health that they have done at Kaleida is have a no-lift system where you have the equipment that you need to lift a patient's.
When did we need it?
Yesterday! It's safe for the worker, and in the end, that's great for the facility because it saves money in workers' comp, obviously, and also it saves backs.
For over a decade, the union has faced insurmountable obstacles reforming legislation. Elected officials have discussed, debated, and ultimately disappointed.
And it was voted on in the Assembly in 2011. In the Senate, it was voted on in 2012, but it wasn't voted on in the Assembly.
However, for the past year, the CWA District 1 Healthcare Council has fought back, staging a campaign of education and advocacy.
What do we want? Safe lips! When do we want it? Now!
There's no way that any of us can afford to sit back.
The reason I'm here is I don't want to be somebody who just rocks the boat. I want to be someone who rows the boat.
Yeah.
The folks that have different interests from us are working out there every day. They have a lot of money, they have a lot of resources. All we have really is us getting involved. And if we don't give 100%, then there's no way we can win on these issues which are vital, not just to our working conditions, but to being able to go home and sleep at night knowing that you've done a good job taking care of your patients that day.
We need to come together as an entity and really reach out to our political advocates because they're the ones that can make it happen.
Numbers count. When it comes time for them to get voted in, this will be remembered.
And we appreciate the fact that we know you're a sponsor. If they can get a bill through in 36 hours, I think after 11 years, we have reasonable expectations. Let's see safe patient handling make it through both houses this time.
And LPN Lisa Drake has a message for those who voted no on safe patient handling.
What if that was your family member? What if that was your family member in a nursing home or in a hospital that wasn't getting the proper care because of a lift? You got to put yourself in their situation. And how would you know, you want your family member to have the best care. So that's how we feel.
What do we want? Safe staffing! What do we want now?
During their visit to Albany, the Western New York contingent joins healthcare workers from around the state. It's a day of action there, calling for regulations on nurse-to-patient staffing ratios.
Nobody, God forbid, wants their family member to be in need in some way and not have a nurse available right away, and that's what safe staffing is all about. It's about having enough nurses to take care of the patients in the way that you would want your family member to be taken care of.
Safe staffing, save lives! Safe staffing, save lives!
Standards throughout the United States are, 1 to 2 on this, and unless the employer is made to hold to these standards, they're always trying to, variate. Oh, somebody called in sick, or we don't have, a nurse for this shift.
Patients deserve safe staffing!
I take care of acute stroke patients. I go to CAT scan with those patients, and my 3 other patients take care of themselves. And it's not right. They deserve me, and they deserve better.
Nurses are struggling to manage 10, 15, and 20 patients at one time. Unthinkable!
There will be actually 3 nurses taking care of 30 patients. High Point is considered a skilled nursing facility.
We are rallying here today about 2 New York State bills before our legislator. The Safe Patient Handling Bill and the Safe Staffing for Quality Care Act. Both are essential, and we view them as interconnected.
I also am sick of listening to my younger people saying the union when we are the union.
It's everybody's concern. It's everybody's job.
Let's get this law passed. We need to help one another.
It's only when we really stick together and we all pitch in, that we all participate, that change can happen.